Ladies and gentlemen, I'm Alaa Eldanasoury. I'm the Chief Medical Officer at the Maghrabi Hospitals and Centers. I'm very happy to participate in this session. Many thanks to the Oman Ophthalmic Society, the ISRS, and Dr. Anas Ambari for the invitation. I was asked to talk on the Phakic IOL complications in 5 minutes. These are my financial disclosures. I'm consulting to Star Surgical, the manufacturer of the ICL. The two most commonly used phakic intraocular lenses nowadays are the Artisan or very size, Artiflex or Veriflex lenses. These are iris fixated lenses that are used to correct myopia and myopic astigmatism. They are excellent lenses with very good refractive outcome. However, the most dramatic complication of iris fixated lenses is late endothelial decompensation, and this might happen because these lenses are closer to the endothelium than posterior chamber lenses. We published last year a retrospective analysis on the long-term effect of iris fixated lenses on endothelial cell density with a mean follow-up of 1.8 years, and our conclusion was that the endothelium is endangered if the anterior chamber depth is shallower than 3.5 millimeter, or it's better to measure the aqueous depth, and in eyes with an aqueous depth of less than 3 millimeter, there is a risk for late endothelial decompensations. So the conclusion of this study was that anterior chamber depths must be deeper than 3.5 millimeter, or better to measure the aqueous depth from the endothelium to the crystalline lens, and this has to be deeper than 3 millimeter in order to have a safe endothelium over the years. Posterior chamber lenses are more commonly used for the correction of myopia and myopic astigmatism than iris fixated lenses. ICL is, of course, the leader in this field, and we have to differentiate between the ICL before the central hole and the ICL after the development of the central hole. Before the central hole, the most important complication was the development of anterior subcapsular cataract. Though the incidence is very low in our hands, less than 1% with the model V4B or older models, and the main reason for development of this anterior subcapsular cataract with ICL is the touch between the crystalline lens and the back surface of the ICL. As you see in this anterior segment OCT, this ICL has a shallow vault, and peripherally the ICL is touching the crystalline lens. If this ICL had a hole in the center, then the development of cataract in this patient would be a very remote possibility. This is why, since we started using the EVO and EVO Plus, the ICL with the hole, we did not see any case of metabolic cataract so far. We've done thousands of cases for the last 7 years, and we did not see any anterior subcapsular cataract in an eye who had an ICL with a hole. We retrospectively analyzed 410 consecutive cases using anterior segment OCT, and these cases were done by one surgeon using the STAR online calculator system, and we had the most important complication was an oversizing of ICL, 2.9% of the cases. 1.7% of these cases had to be exchanged, mainly because of the high IOP or narrow anterior chamber angle. Undersizing is less common, 1.2%, and half of these cases had to be exchanged because of a rotation of a toric ICL or a crystalline lens touch. A misalignment of a toric ICL happened in 1.1% of our cases, and the most important cause was a wrong placement of the ICL during the surgery. In this case, you can go back and reposition the lens. It's an easy procedure, and usually the lens stays in the new position unless it is undersized. So to summarize, the most important complication of iris fixated lenses is late endothelial decompensation, and this can be prevented by including only eyes with deep anterior chamber with an aqueous depth deeper than 3 millimeter. Posterior chamber lenses remain the best choice. However, sizing issue is the most common complication, and this can be managed by exchanging the lens, which is an easy and safe procedure. Axis misalignment is usually due to wrong placement during the surgery, and repositioning is a simple procedure. And I thank you for your kind attention.